I'm Dr. Laura Rock, an intensivist at Beth Israel Deaconess Medical Center in Boston and Harvard Medical School. I'd like to talk about G.I.V.E, which is a tool for responding to emotion with empathy. In healthcare and in life, it's very common to respond to expressions of emotion with information or data or simply reassurance. The problem with doing that is that we're missing an opportunity to connect, to better understand what's driving the emotion and help the person feel heard. Here's an example. Hey mom, I'm not going to school today. I have no friends. Well, of course you have friends. Sally just invited you to her birthday party. Or we may respond with task-oriented listening, like, here's what you have to do. Today, wave to 3 new people in the cafeteria. Well, the problem with what I call answering feelings with facts, again, is that this person is expressing a problem or a feeling that is unresolved by simply being assuaged or getting an idea of how to resolve the problem. So it's really important to recognize what's going on and validate and even try to understand it better. And one way to do that is with this tool called G.I.V.E. I normally don't like mnemonics because I don't remember them too well, but if all you do is remember to give when you recognize emotion, that's probably enough. If you would like to know the steps, I will illustrate them. So the G is getting that there's a problem that may need more than a quick response. For example, if a colleague says, I've lost 3 patients this week, I don't know how much more of this I can take, getting that there's something really important going on here that may require something more than, don't worry, I'll take your next call shift, is critically important there. I is identify. Identify what behaviors are you seeing that may be suggesting an emotion present. It may be something obvious like crying or screaming, but it may be more subtle. So saying something like, I'm noticing you're not talking as much as usual today, or I'm hearing this sounds really overwhelming. It can be really important for establishing and kind of being on the same page about what's going on. Validate by acknowledging the emotion present and normalizing it. Anybody would feel devastated in this situation. Or I'm noticing that it's really, really hard that you can't come into the hospital right now. That would make anyone feel isolated and frustrated. Explore to better understand the emotion. It may be something like, can you just tell me more about that? Or what's scaring you the most if they express fear? So it's not important to do all 4 of these steps. It may be enough simply to pause and be present and embrace what the person is experiencing with silence. But it can be really useful to try each of these steps. Exploring can help surface critical information, such as if someone says, I know I'm supposed to have this procedure next week, but I'm really scared. And we respond with, oh, don't worry, your surgeon does 400 of these a year. You're in great hands. We may be missing a really important opportunity to uncover something that can actually improve their care. If you said, what's scaring you? And they say, well, my brother had a procedure last year and he had sudden cardiac arrest during the surgery, that's going to probably trigger a different pre-op workup. Or if they say, I have a really hard time recovering from anesthesia, or last year when I had a procedure, I got dehydrated and ended up getting atrial fibrillation. Again, this may be critically important for managing the patient and avoiding a safety problem. So when you recognize emotion, you have some tools to help a person feel heard, build trust, diminish the intensity of emotion so they can better participate in the conversation, and maybe even learn more to help the patient.